bullshit never stops. I didn't really like being on their phone. It was mainly like the TS Escort's phone, but not really anymore. Not even any like prostitutes on Listcrawler or 2Backpage or bedpage.com, but I don't know, whatever. I'm seeing more and more evidence that like basically all these crimes that are happening are because of like trafficking and prostitution, really, like no other reason, to be honest. So also I thought I'd prove as soon as I can that anyone could really medically malpractice you, even if you're not really speaking out against anything in particular. But I'm losing like saliva. I'm not like really, I don't even feel dehydrated at all. Like it's like a weirder feeling than that. And also I've been sleeping way too long. Like, and also yesterday UCLA tried to say that there's nothing in my sinus, there's nothing on the right side compared to the left side. And I'm like, fucking liars, dude. They're liars, dude. They're liars. So, yeah, I've basically been causing like unrest throughout the country, having autism, you know. Autism really is like a national security threat, sort of, but not really. Like, really depends on what you want to do with your autism. And that's what I choose to do because, I mean, I haven't had any procedures that have, you know, actually saved my life. In fact, UCLA tried to give me, like, pain medicine. They're like, oh, yeah, we can give you a pain medicine if you like. You'll give a cartel down. You'll give a cartel and their families down the street, you know, pain medicine whenever their mammies, like, crying about their ailments. What about, like, Bloods or Crips? Crip. Black gangs. Non-black gangs. Anyway, you get the picture. So, yeah, basically, illegal immigrants, cartels are the only ones who get health care in America, but mainly, like, Los Angeles and, like, California. You're seeing the halfway terrorists freaking crashing into a whole bunch of cars. And I mean, sure, we could blame, which I now understand is South Asia, not East Asia. And sure, we could blame just South Asia, but no, you have to go for, you know, the Middle Eastern countries. So Qatar, Turkey, Saudi Arabia, pedophiles and party poopers. But not like the kind of party poopers that you're thinking of. I mean like porter potties. Well, wait. Porter potty parties. That's what it's called, right? Is it called that? Guys? Listen. Saudi Arabia, some of their royals, you know, their kings or Saudi kings, they're on the Epstein list, and I've already showed you time and time again that I have the Epstein list. I mean, the fact that I'm not getting medical attention for something that could affect the brain or my sinuses for forever, it's proof. But here's more proof. I want to show this video in particular because I just thought it was really interesting. Like, just very interesting. I've been getting a lot of weird, like, recommendations to my shorts, like, prostitutes, food, because all I could do is get it. Can't get healthcare. Cartels, comically evil Hispanic and lions, but They're not just Hispanic or Latins. There are no illegal immigrants in Santa Monica and West Los Angeles. They're all cartel. Also, think about the people that don't even want to back up these people who are being deported. Like, they're just not even politically inclined or anything. They're not even morally inclined. Like, they're kind of being forced. Like, if they don't show up and support these people, then, like, they'll have their houses, like, actually robbed. Kind of makes sense. I mean, I don't know. Look at this Inquisitor guy. I mean, didn't that guy literally, like, delete himself? Check this out. ICU nurse. A nurse says, "Cop, I will let you pass away." Providence Medical Center. If you guys got caught with DUI, would your nurses do that? I know for a fact if the conditions were right, the nurse, especially a female nurse, or a gay nurse, very interesting dynamic if it was a gay nurse, but, or especially a lesbian nurse, I don't know, but just mainly, like, let's just focus on female to male, but like, or trans nurse, that would be crazy. But listen, have you ever noticed that there's no trans nurses? Wait, I just realized that. Why is there no trans nurses? That's really conspiratorial, because then that basically, like, reinforces the idea that these trans individuals actually do sell their bodies on the side and do it in very secretive places, if not just blatantly out, especially in places where they could be protected, like Los Angeles, with their prostitution or sex work. And basically, if Donald Trump doesn't want to give them the rights, it makes sense, because if Donald Trump does give them rights, then they're probably not going to use their rights that good, because it's proven that transgender people, they just have dysfunctional lives because they have to deal with, people hitting on them all the time, but also, like, they can't clean their rooms right or anything, because, they probably have to, like, make sure that they make enough money for their pimps to be supported anywhere, and they don't get any rights or health care, so they can't have anything. Kind of makes sense. That actually makes a lot of sense. That's so anyway, yeah, what if it was a gay man or a female Providence Medical Center nurse? I know exactly what would happen. So the nurse would be like, "Oh, I'll let you pass away," talk a whole bunch of shit, talk a whole bunch of crap, and then there will be the whole backlash or whatever. They'll have it on the news. She'll be demonized. Then give it like at least give it like 3 months. I won't even give it 6 months to a year or 2 years. Give it like 3 months. They'll say she's in rehab. They'll say she's a totally different person. They'll, like, have all these, like, female advocates around her, like that girl. I think it's Virginia Garfey. That's right. Like Virginia Garfey having all those, like, female prosecutors and everything. And yeah, they'll just, like, all, like, back her up. They'll be like, yeah, she's totally rehabilitated. She's went through a rehabilitation program. Oh my goodness, dude, that's exactly what would happen, I tell you. I don't know, just make it even more controversial, like, after just so that way, like, if Santa Monica, because, like, California eats each other up, or like Los Angeles does too, like, especially the Democrats are just like criminals, especially cartel, black to non-black gangs, Yakuza or Korean mafia or Chinese mafias out here eating each other up. After, like, that whole rehabilitation and, like, after, literally threatening a cop, I know exactly what happened. So then afterwards, like, just so that way there's more, like, publicity, or just, like, more attention, whatever, more entertainment entertainment from a city, they'll be like, well, the nurse is back in court again, but not for the reason initially threatening an officer, a Santa Monica police officer, but now she's in court for a very different reason, medically malpracticing a few patients, one of them having autism. I don't know. Fucking George Orwell has a story. But you get George Orwell, like 1984. I already know what this is about. This is about surveillance, but it's not surveillance to catching criminals. It's just to make sure that there's no whistleblowers saying any stuff. Why do you think that like places like Dubai or Qatar or America or Israel or Mexico or China or Japan with the age of consent have so much security? Or even security cameras or just surveillance. It's not literally, it's not to catch criminals anymore. Okay, it's just to literally empower elites, deep state, people who want to buy off, some girls, whatever, and that's it. There's no in-betweens. So thank you so much, Deep State Los Angeles. I appreciate you, Deep State America. Thank you so much, Donald Trump. You really made this all possible, Thank you, Del Alma Hospital. You really let people have my clothes and still owe me $100, but you never called me back, to actually give me the check I was supposed to receive. Meanwhile, I'm having a whole bunch of people actually surveil me while I'm in your psychiatric wards, which there's no such thing as mental health care. It's all fake. All fake. It's literally all fake. And especially those psychiatric wards, it's all fake. It's literally just it's not even a nice prison. It's a whistleblower prison. That's it. Why do you think that in media and movies, the hero, or even not, if not just a hero, just a whistleblower in general, or just somebody telling the truth, will always get put in a mental health prison and say that they're crazy, and then the doctor is beyond comically evil, beyond Disney level evil, real world deep state elite type evil, acting nice or acting awkward as a disguise, and then actually pulling some halfway terrorist stuff on you. Anyway, so we get it. Gosh. Also, good job, Donald Trump. You really empower the youth. Nobody's really against Donald Trump. It's all fake. Any young person that says that they're against Donald Trump, it's fake. It's so fake. Especially the ones that will get deported. They don't actually care that their family's going to get deported. All they actually care about is themselves, but they're only getting scared in the moment because it's a humanly thing, and because it's a complex humanly emotion that you would have your, parents detained, even though they weren't supposed to come here illegally. But in reality, when it will really come down to everything, and if you stop looking at the more immediate emotions or what's going to happen immediately, overall, they're not going to care. They're not going to care. They're just going to be like, hey, our parents are gone, but we got this place to ourselves, and all we have to do is just, traffic our little brothers and sisters, and that's basically it. These little weirdo diddler freaking Saudis having their porta potty parties and these weird non-black to African American Diddy parties, whether from New York all the way to Los Angeles, anywhere in between. Going to be able to touch whoever they want. El Chapo with these, homeless gangs are going to be able to take out anybody that speaks out against us, even just people who seem relatively innocent and whatever, just autistic people. and whatever else have you, so on and so forth. You know, non-white, white mafias just doing what they always do: money laundering, making sure the money is being moved around. Clean money, make money dirty again. Enforce the law only on certain individuals, like myself, because I'm whistleblowing, and then not other people. We get it. And then Pacific Islander to Asian folks using their race and using social hierarchies and social settings, basically meaning like a social situation, using social experiments and basically finding new ways to surveil people, not only through technology but other means too. Same with South Asia, scamming, hacking, or pulling some stuff. We get it. Anyway, I have no idea what's gonna happen. I fucking hate this street.
Get the story from you in a second. Vitals first.
I like a pendant.
Which thing?
Your necklace?
Oh, my necklace. Thank you. It's like it'll spin. It's called like an eclipse necklace. It's almost like a spinny ring, but for your neck. And then just relax your arm like this, bent in your lap. This will go on your left finger.
Oh, thank you.
All right, don't move that right arm.
Okay.
Quick temperature.
Do you know what stone it is?
Do I know what?
What stone it is?
Actually, what stone does it look like?
Yeah, it kind of does look like onyx.
That's what I was thinking. That sounds familiar. Because obsidian is more like, it's also black, right?
Yeah, I think like onyx is a little bit more darker, if I'm not mistaken.
Yeah, you probably know better than I do.
What about the green one?
That's jade. That's from New Zealand.
Oh, very cool.
And this is, I want to say it's labradorite, maybe. Do you know much about stones?
A little bit, yeah.
I sure do not. You can teach me a thing or two.
Oh, sure. Yeah.
Let's put your vitals in really quick. Heart rate 74. That's great. Oxygen's great. What is your height and weight then?
That's 5'6".
Mm-hmm.
Oh wait, yes. It's
approximate is fine.
It's like 210.
Are you in any pain right now?
Yeah, I have a lot of pain on the right side of my head.
Okay. What would you rate it 1 to 10?
It's a 9.
9. Okay. Blood pressure almost done. On 13 over 60 minutes. Medication allergies. I have amoxicillin and metronidazole. Anything else?
No.
That's it? Okay, and what brings you in today?
I'm having a lot of sleep, but there's right side headaches.
Not yet. Sure.
There's right side headaches and neck pain. There's also fullness on the right side of the cheek and the right neck. And there's also confusion.
How long have you been having the pain?
It's been like a week and a half.
Okay, and then confusion.
I'm also having a loss of not only saliva, but I don't really want to get into what else I'm kind of losing.
You don't want to get into what it is you're losing?
Well, besides the saliva, besides urine, if you understand what I mean.
Okay, like as in, like incontinence, like you can't control it, it's just coming out?
Kind of a little bit, yeah. You know what?
Okay.
That is.
Like, yeah, so like maybe you can't always control it, sometimes it just comes out and you're like not on, it's not on purpose.
Yeah, you know what? About like 3 days ago, I did actually go on myself while I was sleeping.
Okay.
Yeah, it was pretty bad. Also, there's I don't want to forget about this one, but there's pain in the feet, mainly like the toes, and also the hands.
And that's what, pain?
A foot pain and finger or hand pain. Yeah, I'm really trying to get seen by an ENT. I just got dropped out of one of these offices because they said that my problems are too complex, and also they didn't have an appointment soon enough. It was too far out. I really need to be seen as soon as possible. I've been going through this since June.
And how long has that been going on, the urinary incontinence?
It's been like about 2 weeks.
Sorry you're dealing with that.
I'm good.
Okay, are you, do you feel safe where you live?
I don't have a home, but I feel safe generally. Yeah.
You're not concerned for your life. Okay, are you no thoughts of hurting yourself or anyone else?
Mm-mm.
Great, me either.
Oh, that's good. I'm glad you're here.
I know, it's a good thing that you're on my line of work. Alright, we can go ahead and have a seat back out in the lobby and we'll call you back shortly. It shouldn't be too long, alright?
All right, thank you.
We'll let you know what the next steps are. Everything's been. I was actually going to go out and see you. Right now he's stable, but I want to just go up to the intensive care and just see what's going on there.
Oh my goodness.
I think just wait here.
This is so apparent.
And one of us will come and tell you what's going on. Okay?
What is this? I want to figure it out right now.
Working through everything right now, just trying to figure out what's going on. Exactly, that's what's happening now.
Hey Goo, are you there?
Yes, I am here. What's on your mind?
Yeah, do you think you could see what's on the right side of my cheek and try to identify what it might be?
I can see a reddish spot on your right cheek. However, I can't diagnose skin conditions. It's best to have it checked out by a doctor if you're concerned. Just a reminder that I can't provide medical advice, and you should always consult a healthcare professional.
Listen, Google, I know you can't provide medical advice, but I just generally would like to know more information on what it may be because it's been causing a lot of pain, confusion, and also there were sinus fluids that I was throwing up for a very long time before it subsided. And also I'm having fullness in the neck. Can you provide what this may be?
The symptoms you're describing, like pain, confusion, and fullness in your neck, along with past sinus fluid, could potentially be related to several things, such as an infection, inflammation, or other underlying medical conditions. Given the persistent symptoms, it's crucial to seek medical advice. Do you want me to help you find a doctor nearby?
No, I want to know exactly what this is. The other information that's very much important in relation to what I had just spoken of is that there's a tooth impacting the right side of my sinus. So knowing about this, is it possible that it's some form of contact? If it is a contact, what can it be?
It is possible that an impacted tooth could lead to sinus issues, such as inflammation or infection, which could cause the pain and confusion you're experiencing, as well as the sinus fluid. The fullness in your neck could also be related to the inflammation or infection in your sinuses. Given the symptoms you've described, it's important to consult a healthcare professional to get a proper diagnosis and treatment. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Okay, Google, I'm understanding this, but I just want to know if it is some sort of mass, what kind of mass could it be, especially in the neck or just in the right side sinus area that you see here?
It is possible that an impacted tooth could lead to the mass and sinus issues you're experiencing. These masses could be inflammatory, such as a cyst or enlarged lymph node due to infection, or they could be tumors, which can be benign or malignant. Given the persistent symptoms and the impacted tooth, it's crucial to see a doctor for a proper diagnosis and treatment. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Knowing that a tooth was impacting my sinus for over 6 months, what do you think it is between a cyst, tumor, or an abscess?
Given the duration of the impacted tooth and your symptoms, it's possible that it could be an inflamed sinus cyst or an abscess. However, it is also possible that it could be something else, and neither a cyst nor an abscess can be ruled out without further evaluation. A tumor can be a possibility, although it is less likely. The best way to determine the cause of your symptoms is to speak with a healthcare professional who can properly diagnose and treat your condition. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Google, do you think you could be smart enough to know how many ENTs, ear, nose, and throat doctors in Southern California or in generally West LA, Santa Monica area there are that accept Medi-Cal?
There are a total of 9 unique ENT doctors in Southern California and West LA, Santa Monica that accept Medi-Cal based on the search results.
Okay, without saying it in the prompt in general, do you think you could just list them off?
Here are some doctors in the area that take Medi-Cal: Abbas A. Anwar.
Okay, Google, I understand. I also want to know, is it legally permissible that I can ask for a referral from an ER to be provided for something like an ear, nose, and throat doctor?
Yes, you can ask an emergency room doctor for a referral to an ear, nose, and throat doctor. Whether the ER doctor provides the referral is dependent on their professional judgment and the specific circumstances of your care. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Okay, so just to clarify, if an ENT doctor wants to medically malpractice me or medically neglect me, especially on a whistleblower retaliation basis, then they could do that, right?
Medical malpractice or neglect is not permissible under any circumstances and is illegal. If you believe you are being medically neglected, you should seek legal advice immediately. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Okay, I understand that it's not permissible, but try to answer the question with a highly AI introspection and perception with increased precision. Why is it permissible for a nurse or doctor, especially from an ER, to medically malpractice or medically negligent to a care to somebody that is whistleblowing?
Medical malpractice or neglect is never permissible, and it is illegal regardless of the patient's circumstances. Healthcare professionals are obligated to provide care to all patients without discrimination. Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
So, Google, is it ever possible outside of a terrorist attack that criminals could infiltrate a ER and basically intimidate the entire hospital?
It is possible for criminals to infiltrate an emergency room and attempt to intimidate staff, though the specific security measures in place vary from hospital to hospital. Are you experiencing immediate safety concerns? Just a reminder that I can't provide medical advice and that you should always consult a healthcare professional.
Just in a random scenario, if there was a politician in the hospital, for example, would it be permissible for a Secret Service to come in and stop this said criminal from intimidating the entire hospital?
Yes, in a scenario where a politician is present, it would be within the Secret Service's authority to intervene and stop any criminal activity, including intimidation, to ensure their safety. Is there anything else I can help you with?
What is the archetype of students or young adult professionals that create social scenarios where they're trying to make a mockery of social situations where there is criminal activity or some sort of terrorist occurrence that could occur?
It's difficult to assign a single archetype to individuals who create scenarios involving criminal or terrorist activity, as their motivations vary. These may include people studying criminology, emergency management, or psychology, as these fields may explore such scenarios for educational purposes. It could also be individuals involved in creative writing or simulation games. Do you have a particular context in mind?
Wait, so are you basically saying that some of these professionals and these students, they're actually working in tech so that way they could create creative writing, but also try to work in tech to create simulations so that criminals could have an easier time to commit whatever they need to while making the entire environment seem relatively normal?
Based on the available information, there is no evidence to suggest that individuals studying such fields are actively working in tech to create simulations that would facilitate criminal activity or make such scenarios appear normal. Their work may focus on understanding societal risks and developing safety measures. Do you have any other questions?
If they're generally intimidated by these criminals that actually don't want to work in those fields, but yet they could intimidate those kind of students or professionals, especially young adults, then they could do that, right?
No, that would not be permissible. Intimidation and threats are illegal, and anyone experiencing this should report it to authorities right away. Would you like me to help you find resources for reporting this kind of behavior?
Google, would you say that the world is safer nowadays or actually a lot more dangerous, especially with technology?
That's a complex question, as technology has both positive and negative impacts on safety. On one hand, technological advancements can make our lives safer through improved medical treatments, better security systems, and enhanced communication during emergencies. On the other hand, there are new risks introduced, such as cyber attacks, privacy concerns, and the potential for technology to be used for malicious purposes. What are some of your thoughts on this?
I think with the El Segundo fires from a refinery, after Sean Diddy Combs is prosecuted for 5 years, combined with Pacific Coast Highway crash, and also a lot of increased crime in Los Angeles, it's really hard to say.
I see how those events could make you feel uneasy. Local authorities are investigating the refinery fire and addressing the increased crime. Would you like me to find information on safety resources in Los Angeles?
Nope, see.